So she asked 4 questions. First one was, how do we build on shared values of society, and how do I do a social equities take on that? And my response there is, well, all income groups are stakeholders in the process, so are they all consulted on the interventions? Do they have as much say in how the intervention is designed? What role do they have in it? And do they share the same priorities for health improvement? And that's quite important. We've been involved in a study in kindergartens here in Europe, in several different countries in Europe, and the interventions work best where parents have been involved and teachers have been involved in the design and, if you like, ownership of the intervention. It doesn't work otherwise. And I fear that the parents who are most motivated to get involved are those whose children are least at risk. So there's sort of inverse care problem there, that it won't be the best option for the lowest income families. So you need to make extra efforts to ensure that lower income families' parents are involved in these things. How do we work across sectors to improve health? Well, if you take a social determinants view, I take a particularly not just social but commercial determinants view, and very much endorse what Barry was saying about the way in which the industry has taken over, if you like, a lot of the policies for food and nutrition development in countries. And so if that's the case, then the challenges here for working across sectors is actually to think, well, where is the money going? Who has the money? Who's making money out of obesity? And how do we challenge that? Because the food industry has a direct investment in obesity. We eat more because eating more because we're fat, we keep ourselves fat, and that's a huge benefit to the food industry. But also the treatment industry, the obesity treatment industry, the diet industry, they are big challenges to tackling obesity effectively. And I don't know how you can work with these people to tackle obesity, because their money is on maintaining a high level of obesity. So you have to be really clear about these things. 2 other questions Vivica asked. Creating equitable opportunities for healthy choices and environments. Well, there we have to think, well, how are we going to intervene across the life course particularly? How are we going to turn the compounding disadvantages into compounding assets? How are we going to make sure that our interventions are actually investments, if you like, in the future for children? I'm not sure how, if I'm not just restating the question there, but it's a question we do have to keep asking ourselves and reiterating as we go through a process of policy formation. And we have to recognize perhaps that different socioeconomic groups have different underlying mechanisms or responses to interventions. And it isn't just a matter of doing more of the same for disadvantaged groups. We need to be quite clever in our design and, as I say, involve the recipients of our intervention in how things are designed and undertaken. And lastly, Vivica asked, how do we improve the quality, efficiency and equity of health and healthcare systems? That's a big one, because health services themselves are riddled with problems, with prejudice, with stigma, which actually makes treatment not so exciting, particularly if you're a low-income person. I think it's quite hard to take yourself to a doctor, be often rather patronized by the doctor, offered some treatment, you go along, you don't really like the way you're being treated in the treatment center, you tend to drop out earlier, and so your obesity tends to get worse, you have higher comorbidities and so on. So there's a whole sort of cycle of issues involved in health services and inequalities in health services that need to be addressed, and underlying all of these, of course, is the whole social narrative of obesity and who is to blame for obesity. And even just to start that question, I think it's another half hour in itself. So I'm going to stop at this point.